Hi, I'm John Zvijac from Miami, Florida, and today we're showcasing a labral repair technique using the NanoNeedle Scope 2.0 and the accessory Lumen PassPort. This setup allows for ultra-minimally invasive access and enhanced maneuverability. We've already established our portals, and the accessory Lumen PassPort is positioned to facilitate suture management and instrument passage. You'll see how this design improves efficiency and flexibility during the repair. Here's what the accessory Lumen PassPort looks like. We have a center hole for instrumentation, and then there is an accessory Lumen, which allows for passage of a multitude of micro instruments for suture management. Here we see the NanoNeedle scope in the posterior shoulder portal and the accessory PassPort Lumen anteriorly in a rotator cuff interval. A little pro tip, the accessory portal, if you can leave this inferiorly or posteriorly, it makes it a little bit easier for suture management. It's not that big of a deal. You can always put it in any position, but that's a little pro tip to help as you're moving this along. You can see the soft tissue Bankart lesion that's occurred. This is the labrum all the way down, and we're well past the 6 o'clock position to allow for bringing the capsule both superiorly and laterally onto the articular surface. The labrum often falls not only medially, but inferiorly while you're doing these type of surgeries, so it's important to free all of this up for proper mobilization and tensioning. We'll be repairing this labral tear with the 1.8 millimeter knotless fiber tack anchor. This is being done through the central lumen of our PassPort. And now we're going to pass the Nano suture retriever through the accessory portal in our PassPort. You can see it coming through, and we can easily pass our stitch with the use of a scorpion through our central portal. And now we're going to just easily shuttle our loop stitch through our center portal. And now we're ready for shuttling our repair stitch, keeping very nice suture management, preventing tanglement of the stitches intra-articularly. We're going to take this stitch out through our center hole to allow for final cutting of the stitch. Here we're using the flush cutter, and we can just bring this down the central portal, and we can cut our stitch flush, and we're ready for the next stitch. The repair is completed with precise suture placement and minimal disruption to the surrounding tissue. The accessory Lumen PassPort enhances suture management and expands our instrument options for suture passing during a labral repair. Combined with the NanoNeedle Scope 2.0, we're moving closer to an ideal solution for the ultra minimally invasive arthroscopy.